Hi, I'm Dr. Koushik. I'm consultant pediatric surgeon and a pediatric urologist at Manipal Hospital, Sarjapur Road. I'll be talking about a condition called Periureteric Junction Obstruction. Pelvis means it is related to the kidney. The part of the kidney which connects to the tube where it carries the urine down to the bladder, that part is called as pelvis, and the tube which carries the urine is called the ureter. Developmentally, when the baby is being formed in the mother's womb, these two are separate structures and then they join together. The junction at which the pelvis meets the ureter is called the periureteric junction. During the development of the baby in the mother's womb, there can be small little accidents in the terms of defects or congenital defect where this area is narrower compared to rest of the pelvis and the tube. Because of this narrowing, the urinary flow from the kidney into the ureter can get obstructed. You can imagine this to be like a dam in a canal where it is regulating or blocking the flow of water. Therefore, there is a lot of urine which gets collected within the kidney, causing it to swell. This is called as hydronephrosis. This is an image which shows hydronephrosis. This is the kidney. This portion which is bulged is called the pelvis, and the tube down is called the ureter. Pelvis joins the ureter at a place called as periureteric junction. This place, if it is narrowed down, then the condition is called as periureteric junction obstruction. Because there is an obstruction, the urinary flow from the kidney into the ureter is blocked or reduced, and the urine starts collecting within the kidney, causing a swelling, and this is called as hydronephrosis. When is periureteric junction obstruction most commonly detected? Mostly PUJ obstructions are detected during pregnancy itself when the mother undergoes the antenatal anomaly scan. They would have mentioned it as hydronephrosis of whatever the degree present. These conditions are usually followed up, and post delivery, as a pediatric urologist, I would follow these cases and order a few tests. Now, what are the tests that we do? An ultrasound to see what is the degree of hydronephrosis, that is the degree of swelling. A nuclear medicine scan called as DTPA scan or an EC scan is done. This is usually done at 1 month of age, and this will give us an idea as to what is the degree or the extent of block. Is it a complete block or is it a partial block? Based on these reports, we then plan the surgery. The surgery for periureteric junction obstruction is important because of these following reasons. The kidney, once the baby is born, has filtering units called nephrons. These are fixed, just like brain cells. As a child grows, the nephron number doesn't increase, but it only increases in size. So when there is hydronephrosis, because of the pressure in the kidney, the nephrons can get damaged, and this damage is permanent. So addressing this is important to prevent future damage and loss of function of the kidney. The child can also have urinary tract infections if this condition is not corrected. So what is the surgery done? The surgery is called as pyeloplasty. It can be done as both open and laparoscopic, but these days it's more commonly done with minimal invasive surgeries, that is laparoscopic surgery. This involves removal of that small segment which is narrowed and stitching back the pelvis with the ureter so that the caliber or the width of the tube is maintained. The stitches are all absorbable. There will be a small stent. It's a plastic tube which is biocompatible, and it will be removed per urethra, as in through the urethra itself, later after 6 weeks. The stent removal does not involve any cuts on the body in the second time. Periureteric junction obstruction, when detected early, we can preserve the kidney function completely, and it's a completely correctable condition where the child will have a normal functioning kidney and a good future. Do consult a pediatric urologist for more on PUJ obstructions. Thank you.